One massage at a time is the hub for advanced MLD of post-plastic surgery procedures and post-op recovery management.
I am not responsible for any loss or damage that may arise from the use of the information presented today.
This discussion is designed to uplift and inspire you to personally take ownership of your post-surgery process and your direction toward healing safely while making a commitment to self-change. You may or may not have taken the steps yet towards surgery, but I hope this information will encourage you to turn your wellness lifestyle into real action by visualizing, planning, and manifesting a desire for better health now.
Questions you should ask during your consultation. Types of surgery facilities. Understanding your recovery process. Product and supplies. And additional services you may need. Self-care is the ongoing practice of taking care of one's physical, emotional, and mental well-being by engaging in activities and behaviors that promote self-awareness, self-nurturance, and self-love. Your body is a temple. Treat it with respect. Plastic surgeons versus cosmetic surgeons. There are significant differences between the two when it comes to education, licensing, and certifications. Any licensed physician can call themselves cosmetic surgeons, even though they have never completed any training. Asking the right questions about their credentials is a life-saving matter. Are they board certified with American Board of Plastic Surgeons ABPS, or the American Board of Cosmetic Surgeons ABCS? After reviewing their website and patient reviews, you can go a step further by calling the state where they are licensed to inquire about additional certifications, suspensions, and be sure to search the internet for pending lawsuits. Choose a local surgeon that's at least 2 to 3 hours away, in case you have an emergency. There are different types of facilities and not all of them are approved and vetted. It is voluntary for some facilities to undergo inspections, audits, HIPAA standards, and be approved and accredited. Which is why some surgeons' facilities are not required to follow strict standards for your safety. It's important to have licensed credentialed staff to handle emergencies without having to rush you to a hospital. Facilities that are approved and accredited follow HIPAA, Joint Commission, and federal standards. Independent companies will go to check for licensed credentialed staff, an adequate supply of products, cleanliness and sanitized surgery rooms, commercial grade and life-saving equipment, protocol procedures for emergencies. Your practitioner should be certified in MLD manual lymphatic drainage therapy by an accredited affiliation or have continuing education hours by the licensing board of which they have their license or an approved provider. Professions that are providing services are not all certified in MLD therapy. You should ask your therapist if they are certified in MLD, CLT/CDT and is fully knowledgeable of the lymphatic system. Before leaving the surgery center. The next day, after surgery, you will start your incisional drainage massages by a trained medical professional in a clinic setting to remove excess fluid from the surgery site. There are safety infection control measures that are followed. This is not the same as lymphatic drainage treatments. If you are having multiple surgeries, had complications during surgery or have underlying conditions, it is best to stay at least 5 days to be near the surgery center in case of unforeseen emergencies. If you are developing a seroma, your surgeon or nurse will provide incisional aspiration. This can take 2 to 3 times to fully eliminate this overload. Incisions tend to close within 3 to 4 days post-surgery. It is important to wear proper fitting compression garments immediately after surgery to reduce swelling and control fluid. Drink plenty of water and walk every 2 hours for 10 to 15 minutes along with deep diaphragmatic breathing and rest during the first 3 to 5 days. Reduce your salt and sugar intake before and after surgery and be sure to schedule your appointments with your therapist for MLD/CLT recovery management. This process should incorporate a health coach or nutritionist and your future fitness goals.